The Morris Daily Herald, on July 2, 1968, announced that the Women's Auxiliary of Morris Hospital would transform Morris Country Club into a garden of roses, highlighted by candlelight and themed Starlight Night, for what promised to be one of the most exciting events of the summer season. And thus, the very first hospital benefit ball was born, thanks to the creative geniuses of Mrs. Ted Conley, Mrs. Elliott Tratt, Mrs. Karen Hines, and the devoted committee. Over the next 45 years, more than 100 community volunteers have held the title of chairwoman or committee member, raising funds for projects including new specialized equipment for a hospital addition, and most recently, a new cardiac catheterization table. Although much has changed since 1968, one thing remains constant: support from community members like you who have kept this tradition and spirit alive. That brings us to this very evening where, like so many community members over the past 45 years, we have come together to support Morris Hospital and plans for the future. This time, to assure medical care for our community is never again disrupted due to flooding. April 18th, 2013. By 8 a.m., Morris received 3.88 inches of rain in just 24 hours. These record-setting rains led to widespread flash flooding that caused Nettle Creek to back up into the storm sewers that flow underneath Morris Hospital's campus. As the water in the north parking lot began to rise, hospital staff, emergency responders, and volunteers worked to fill and stack sandbags to protect the hospital. Despite their heroic efforts, the water overpowered the temporary dam and made its way to the materials management entrance on the lower level. It was only a matter of minutes before the 75,000 square foot lower level of the hospital was immersed in 3 inches of water, taking the pharmacy, laboratory, kitchen, medical records, and information technology departments out of operation, all of which are critical areas in the delivery of patient care. For the safety of patients and staff, and upon advisement from the Grundy County Emergency Management Agency, leaders at Morris Hospital made a critical yet necessary decision. For the first time in the 107-year history of Morris Hospital, patients were evacuated and most patient services came to a halt. The community was without its local hospital. The devastation was widespread, well beyond the walls of Morris Hospital. By Friday, April 19th, over 4 inches of water had been reported in Morris. The river crested at 24.91 feet, surpassing the 2008 record of 24.8 feet. In the 11 counties listed as major disasters, 41 homes were destroyed, 3,476 were damaged, and 80 businesses were affected. In the days that followed, crews worked around the clock at Morris Hospital with the goal of returning to full operations as quickly as possible. Not being able to serve the community's health needs was simply unacceptable. Thanks to the support from our community and staff, we did the seemingly impossible. 13 days later, full operations were restored. Throughout it all, there was an outpouring of support and sentiments that reinforced just how much our hospital means to this community. May God bless Morris Hospital, its patients and staff. Praying that our little hospital gets back up and running soon. Wonderful, our great hospital is up and running again. As soon as operations were restored, the focus shifted to the real question. What were hospital officials going to do to prevent something like this from ever occurring again? Since then, a number of measures have already been put in place, including discussions with the City of Morris and civil engineers. While studies have indicated it's not possible to stop flash flooding from occurring on the Morris Hospital campus, they have advised that we can take steps to stop floodwaters from entering the building. And that's where we need your help tonight. So far, flood-related expenses have cost the hospital $1.1 million in damages and repairs, $2 million in lost revenue.
These costs will be slightly offset by an anticipated $500,000 in reimbursement from insurance and FEMA. Yet to come is approximately $254,000 in expenses in order to protect and modify the four most vulnerable, low-lying areas on our campus.
On the north side at the receiving dock, on the south side above our mechanical room, on the west side near the outpatient entrance, and on the far northwest corner near the physician's entrance. This we know for certain. Not being able to provide health services for our community is an unacceptable alternative. That is why we are taking the necessary steps in cooperation with community partners to create a mitigation plan that will be successful. The lives of those we touch depend on it, and we are asking for your help. Tonight provides the first opportunity to make a philanthropic commitment to support the 2013 Flood Recovery and Prevention Fund. This fund will help not only ease the financial burden on the hospital, but also create a solution so that future generations who will be served by our hospital never have to experience this devastation again. Please consider a gift.